So, Bob, it's always a pleasure to be able to speak with you
No,
because
my pleasure.
at the end of the day, I've learned so much from you in the short amount of time that we've been working together.
I've actually learned more from you, Paul, so
I
we got to be
appreciate
clear
it.
with that, right?
You're too kind, my
You're
friend.
the mad scientist.
Thank you, thank you. You being a doctor and a surgeon for over 25 years, what was the pull that really started you to pique your interest in the peptides?
Well, first thing I got to say is I started when I was 10. So
There you go. That makes
25
sense.
years.
Absolutely.
No. I mean, the way it initially started for me was actually starting to look at myself. So about a year and a half ago, I started realizing that even though I played Division I tennis at USC and I play 4 or 5 times of tennis and I try to stay in shape, I had aches and pains. I had swelling. I put on weight. I couldn't put on muscle. I felt like my libido was starting to slip a little bit. And I think a lot of it just comes with aging. And what we don't realize is that the human body over time, just like a car or a tennis racket, it deteriorates. And if you don't manage it and you don't maintain it, it's just going to fall apart. And so I started getting into the peptide world for me. And I started on very simple peptides. I started on BPC 157 with TB500. Then I added GHKCU. Then I added KPV. So that product is called CLO, which is 4 peptides together. It's anti-inflammatory, reparative for tendon, ligament. But what also happened was with the BPC 157, my gut health got better. My sugar cravings disappeared. And my bowel movements got better. And I actually started realizing that I was losing weight without having to really worry because I had such a bad sugar craving. I'd eat tons of sugar without realizing it. And then as I started getting more comfortable, I started looking at, I want to put on a little bit of muscle. So I started using CJC with ipamorelin. And I started seeing a little bit of muscle tone coming back. And then I started looking at mitochondrial repair, and I started using MOTS-C, and it was amazing. And so I've started to kind of experiment a little bit here and there with product. The thing that really changed things for me was I started also using it for some of my patients, pre-surgery, post-surgery, tendon ligament injuries, bone fractures, or just patients who were having aches and pains. And it was crazy because they were getting better. And I started realizing that this isn't like a fluke. Peptides are real. And at that point, I had an aha moment, part of which was you when we met. And the aha moment for me was realizing that the peptide world is very fragmented. And it really doesn't have the medical backing that it needs to have.
Right.
And I think you feel the same way.
Absolutely.
So we sat down and we had conversations, and I was like, listen, if we are going to have physicians being accepting of peptides and actually jump into what we call our revolution, we need to offer them what physicians need to feel comfortable. So we need peer-reviewed articles, PubMed articles. We need to educate them as to what peptides do, how they work, where they work, what protocols they need to have available to them. And so that's how you and I got started with Alpha Bioscience.
I love it. And I love that progression of you being the mad scientist for yourself.
It was not easy.
I can imagine.
I mean, going online and trying to figure out what peptides, it probably took me a good month to 2 months to actually even be like, what are these things?
Right.
How do they work? How do I get them? Where do I get them? How do I know it's sourced well? I mean, what people don't realize is 90% of peptides are Chinese manufactured. So the stuff that you see online that's for sale, it's shady.
Right.
So I wanted all of that taken off the table. I wanted it to be physician-driven, protocols written by a board of physicians in different specialties who would then make the protocols for the specialties they knew what to do with. And then education. Like, we want to make sure that physicians are comfortable, patients are comfortable. We offer full customer service when there's an issue. This can't just be here, okay, here's a bottle, go do with it what you want.
Right.
Because you have no clue what you're doing. You know, no clue what you're injecting. You don't know what dosage to use. It's all over the place. And that's where Alpha Bioscience is bringing all of that into, I think, a more structured, physician-driven model.
And that's definitely what I would say is what makes ABS different.
Yes.
And that's going to be the biggest, really the biggest thing that comes into the market for the physicians as far as their mental mind is shifting. Because that's going to be the biggest thing that I've realized with doctors is how do you get them over that mental hurdle of this is real. And what I've noticed is that with the physicians in any space that I talk to, they're really comfortable with things like PRP, with stem cells.
They got comfortable.
What happened there?
Okay. So my mom is a clinical research pathology background. So 20 years ago, I said, Mom, you know, we're spinning blood and we're pulling the PRP. And at the time, we would use these agar tubes, you know, with the little jelly at the bottom, and it would separate and spin. So she's like, so what are you doing? You're just spinning blood. I'm like, yeah, but we're pulling the Buffy coat. And she's like, okay, here's 1,000 agar tubes. That 1,000 tubes cost you nothing. And we would spin blood and pull the Buffy coat.
Okay.
And when I would talk to people 20 years ago about it, they were like, what do you mean, right? Physicians are very slow to change. There was a orthopedic surgeon who has been a mentor of mine, and he said, you know, if you take 100 physicians who come out of residency, 90 of them will only do what they learned in residency. The other 9 of them will go to conferences and listen. And 1 out of 100 is the one that's actually doing the educating and is a thought leader and creating change. You know, physicians are creatures of habit. And also the medical system has been set up in a way where you stepping out of the box creates like you're now an outsider. Instead of being thought as a thought leader, you're an outsider. So for years, people would say like, well, this guy's doing these blood injections, but doesn't make sense. And then slowly the results started to come out. We published our results. Other doctors published their results. Conferences start to accept it. And then it became more mainstream. Then we went to amniotic injections and stem cell injections. And now everybody's like, what are these amniotic injections? You know, you need to be a thought leader. And, you know, everything I've done in my career has been to progress my field, foot and ankle surgery, but also I always want to be looking at what's the next best thing for my patient. Like, for example, bunion surgery, I don't do any of the things I did when I was a resident. The entire process for me has completely changed over 25 years. Not all at once, but step by step by step.
There's an evolution.
Yeah, and so I think that what we're trying to do at Alpha Bioscience is to make education available to physicians from basic to as in-depth as they want to go. And again, I give full credit to you because it's really stuff that you've been working on for 20 years. And, you know, when you look at what you've created, it's, okay, I want something for inflammation. Go to here. Okay, these are the 4 things for inflammation. You can read very basic information about them and then be like, okay, I want something that is category 1. Okay, this one's category 1. Okay, so I feel comfortable with category 1 drugs. BPC 157 is something I've heard about. Let me read more about it. Then you have all of the PubMed articles related to it. So if a physician wants to, they can get a full education on any peptide and all of them.
Absolutely.
And that doesn't exist right now.
Right. And that's a whole library that we've really created for them to go into. Thank you. Thank you. Because you know what? After years of really researching these peptides and seeing the benefit of what it could do to help people, just as you've seen it, that's been the biggest mindset shift for me in order to be able to speak with people of your caliber at your level so that I can go, hey guys, this is really working and it's going to help people. Yeah. And at the end of the day, that's what it's about. So let's back it up for a moment for anybody that's listening and watching this. When it comes to category 1 and FDA approved, can you go into both of those a little bit for us, Doc?
Yeah, I mean, I think that for me, you have to realize something before you can then really accept the mindset, right? As a doctor, when I first started practicing, you know, FDA was everything. and FDA was approving products for the safety of patients.
Mm-hmm.
I think COVID changed it a bit for me because I started to realize that it's not as clear-cut as it seems. And over time, I've also realized that the interests of pharma and the interests of patients are not always aligned.
Right.
Right? One is a money machine.
Mm-hmm.
The other one's just trying to get better.
Right.
And sometimes a treatment and a cure are not the same thing.
Sure.
Right?
Well said, yeah.
I'm going to give you something that makes you better but doesn't cure you.
Right.
Right? That is a eternal revenue stream. So once you start to think of it like that, and then you start to look and say, what is it that FDA approval means? Vitamin C is not FDA approved, but nobody seems to care about that.
Yep.
Creatine, which is one of the most common amino acids that we take,
Mm-hmm.
is not FDA approved,
Right.
but everyone's okay with that. Once you start to look at it at that model, then you start to realize that FDA approval for an amino acid, which is what peptides are,
Mm-hmm.
it doesn't really mean that much. But I think that for physicians to feel comfortable and patients to feel comfortable, if a peptide is FDA approved, that means that it's had more testing done.
Mm-hmm.
So, for example, tesamorelin, which is a peptide that releases your body's natural growth hormones, helps with visceral fat loss, helps with weight loss, is FDA approved.
Mm-hmm.
And it's an incredibly good peptide. But there's also CJC with ipamorelin. There's sermorelin.
Yep.
And these also are similar, but they're not FDA approved. Doesn't mean they're not good.
Mm-hmm.
What we've tried to do at Alpha Bioscience is to set our protocols around FDA approved products or Category 1 products. What does that mean? Well, peptides for years were in this black area or gray area.
Sure.
Where they were like kind of, yes, you can use them, but the FDA doesn't have any involvement in it. And we're not really going to be like judgmental of who's using it. But what it created was this gray area where companies could manufacture peptides in China, or Chinese companies were flooding the US market with peptides, and there was no like rules or regulations around it.
Mm-hmm.
And I think the new administration realized that the peptides that are not US manufactured, are not tested, don't have proper licensing, have a risk of not being pure. So the Category 1 peptides are now bringing that more to a US manufactured product.
Mm-hmm.
And so for us, most of our protocols and most of our physician-driven guidances that we're setting up at Alpha Bioscience
Mm-hmm.
have Category 1 peptides as the main products in them. There's going to be some that we think are really important that are not part of the recently approved list.
Mm-hmm.
But those we've also got so much backing with articles and information on that I feel very comfortable on it. But a majority of what we're trying to do is try to stick with the FDA-approved Category 1 products, because I think it makes physicians more comfortable, makes patients more comfortable, and we know that those products are the most tested.
Yeah, fantastic. It sounds like the way that the medical community has always been is that it's going to be slow to adopt, but then once they've adopted it, it goes like wildfire. And I feel like we're just about at that point. And when it comes to the way that at ABS we've developed the protocol packs for each one of the different, I almost said genres, but not genres, for each one of the specialties for these types of doctors, for every type of doctor that's out there just about, we've really put a lot of thought into it. So when it comes to each one of these packs that I know that you and I went into great detail about, what was a motivating factor for each one of them as you really thought about them and each one of these specialties for these doctors that came up?
Yeah, so I think for me, the process of trying to get the peptides for myself was the most eye-opening, right? I mean, I'm a pretty savvy guy. I'm good with computers. I'm good with AI. I'm good at figuring things out. And it took me months to even understand the peptide world and try to figure out what goes where and how and what to use and when and which one first. And it was a lot of work. Yeah. So I realized how fragmented it is. Mm-hmm. And part of the fragmentation is because organizations that are not physician-driven are not allowed to be commenting.
Right.
right? So they're basically like, here's a bottle of peptide, but I can't tell you what to do with it.
Right.
Or I can't tell you what dosing to take. And I'm like, well, how do you know what to do?
Right.
Right? And so it became a kind of like a process of trying to figure out what and how.
Right.
And I realized that that's missing. Then the second part was, like, you have gym rats who are telling people what to take.
Right.
Or you have, like, you know, a makeup artist who's telling their client, you know what, you should go on GHKCU because it builds collagen.
Right.
Okay, that's true.
Sure.
But what's the dosing? Where do you get it from?
Right.
You can't, you know, it's just really not safe.
Yeah.
And so what I decided to do was to pull a team together.
Mm-hmm.
So we have a medical board. Our medical board is, to me, some of the top physicians in their specialties. And just to give you some of the specialists, we have longevity doctors, fertility doctors, urologist, endocrinologist, rheumatologist, orthopedic surgeon, you know, every specialty that is really going to run the gamut.
Mm-hmm.
And then we have some non-specialists, non-physicians who are specialists in their knowledge base.
Mm-hmm.
So we have a young lady who is a CBD, CBG expert, and she's helping us with a lot of our cream compounds.
Mm-hmm.
And like libido compounds that are like lubricants and stuff. You are on our board. I mean, you have probably more knowledge than any of us because you've been doing this for over 15 years. And,
Yeah.
you know, I mean, I've never seen anyone more knowledgeable on peptides. And so the goal was that each member of the board takes their specialty and starts to build packs around it. And then we also took it one step further. So not everyone can afford a platinum pack.
Sure.
Right? But we still want to make it accessible. So we have a silver, a gold, and a platinum pack.
Mm-hmm.
And they're designed so that you're still able to get treatment and improve your health. And you don't have to be getting the Rolls Royce, but you can still get into the game and start to build that health. And so the specialists are really put in charge of what is it you want to treat.
Mm-hmm.
I have a fertility issue or a perimenopausal health,
Mm-hmm.
or I have hormonal issues, or I have inflammation. I don't recover after sport. Okay, let's put a pack together, and it's all of us working through that together, but with the interest of that specialist's goals.
I love it.
Yeah, and then the next step was, okay, so now we have our packs. We have to make sure this stuff is the best, right? It's not good enough that you have the packs. It's not good enough that you have the education for physicians and for patients.
Mm-hmm.
The product has to be the best.
Right.
And so, again, I came to you and said, find me the best. And we looked around at, how many places did we look?
At least 5.
Yeah.
5 different manufacturers.
And they're all U.S. manufacturers.
Right.
But then we picked the one that we thought was best for our needs and for the patient's quality. And so the process has been kind of a start to finish, building it step by step with the best product, the best doctors, the best protocols, the best guidance,
Mm-hmm.
and the best education.
Yeah.
And so, you know, the goal is simple. Get physicians comfortable, help them have access to the best product, help their patients have access to the best product, and then make it in a model where they can have comfort in whatever way they want to do it. They can cover peptides in the office.
Mm-hmm.
They can refer them to a page where is dedicated to the physician, and the peptides are there available for their patients to buy. Or they can refer them to Alpha Bioscience, where we do a telehealth program, and we will get their peptides on the right protocols. The thing that I think is really important for physicians is you're getting passed by without knowing it.
Mm-hmm.
And I think that's what's really important. If a patient comes in the office and they say, you know, I've been thinking about a peptide, and you're like, well, I don't know anything about it.
Right.
Or you're like, well, yeah, you know, I don't know. Go figure it out yourself.
Mm-hmm.
First, you're not at the cutting edge of like medicine,
Right.
right? The second is your patient is going to get that peptide.
Right.
They're just not going to get it through you.
Exactly.
And so what ends up happening is you become like passed over.
Mm-hmm.
And not only do you not have continuity of care with the patient, but they're going to not look at you at the same level of sophistication as they did when they asked you, I want to get on peptides.
Right.
So part of the goal is to make doctors comfortable with wherever they want to fit. Some doctors don't want to carry peptides. Okay, refer them to our telehealth system and we'll take care of it.
Sure.
But the patient is staying in your ecosystem
Right.
with your control, and you have full understanding of what they're doing so that you don't lose that continuity of care with the patient.
And that's incredibly groundbreaking, because now you're actually giving the doctor the ability to choose when and where they want to fit in with this new modality that's new to them.
Yes.
And how to keep that patient care still going.
Yes.
And for ABS, doing that is really revolutionary. And that's why we tell people, join our revolution.
Yeah.
Because that is what we're doing. I love that. When it comes to the way that, and you touched on it just a moment ago with PRP, I love that, with stem cells. Why have they been so slow? Has it just been because lack of education and knowledge with peptides?
I think peptides are still a little bit wild west.
Okay.
I think that there hasn't been an organization that comes along and justifies why and how.
Mm-hmm.
I think it's hard for physicians to get comfortable academically with peptides, meaning let's take like BPC-157, which
Sure.
is an anti-inflammatory peptide.
Mm-hmm.
It helps with tissue and tendon healing. Okay, great. So I understand that. Show me the results. Show me the PubMed articles, right? It doesn't exist right now.
Mm-hmm.
And for a physician to really drill down, if they want to drill down, it's hard.
Mm-hmm.
I think the other thing is that if you look at where medicine sits right now, physicians have 5 to 10 minutes with a patient.
Yeah.
And the patients are coming in and asking them 5 questions about their health, or one question about one condition that is a complex issue to solve.
Sure.
So in 5 to 10 minutes, that physician needs to do their charting, answer their questions, make sure the patient's taken care of. Putting peptides into that equation becomes another 5 to 10 minute process.
Easily.
Right?
Yeah.
And I think that what's going to happen over time is that at the beginning, a lot of physicians are going to be like, okay, scan this QR code, make a telehealth appointment, and Alpha Bioscience is going to take care of
Sure.
things. But what'll happen over time is as the patients start to trickle back into their practice,
Mm-hmm.
blood work is improved, their health has improved,
Yep.
their weight has gone down, they're able to do more, they look younger, they feel better. The physicians are going to start to realize that this isn't just some pokey, fly-by-night kind of thing.
Right.
And I think that our goal at Alpha Bioscience is that there's going to be some peptides that are within your practice, your bread and butter,
Mm-hmm.
right? So for me, I do foot and ankle surgery. BPC-157, TB500, GHKCU, KPV are no-brainers.
Mm-hmm.
ARA-290 for nerve pain is a no-brainer. CJC, Tesamorelin for patients who are having surgery and are going to lose some muscle mass, or we want to get them to build their muscle faster, no-brainer.
Mm-hmm.
Right? There'll be some of these that are just like clockwork for your patients
Right.
over and over again. So I think what'll happen is a lot of physicians will then bring those into their practice so that patients can just have access to it easily. And then there'll be patients who come in and say, ever since I've had surgery, or, since my mother passed, I know I have anxiety. I feel stress. I feel like I have brain fog, whatever it is. And so for me, that's outside of my scope of what I do, but I'll refer that to Alpha Bioscience and let the telehealth portion handle that.
Mm-hmm.
But both for the accessibility of instant gratification and care of the patient, and both for my own practice,
Mm-hmm.
there's going to be 10 peptides I carry and 40 peptides that I don't carry, but I'll refer to Alpha Bioscience. And we want to make it as easy as possible for the physicians to be able to then take care of their patients any way they feel comfortable.
And that anecdotal evidence that you were speaking about, where the patients go away with the peptides or they use them and they come back, and then the physician is actually seeing improvements in all kinds of things.
Yeah.
The lab work is really going to show and be the proof in the progress, if you will. And I know that I've personally helped numerous doctors, and some of those doctors that we now have on on our board, actually one of our medical directors that have helped with his practice and really seen that. So it's becoming a believer in it. And I completely understand the standpoint that there aren't enough human studies on these peptides.
Yeah, but you know why?
Of course.
Because human studies are expensive.
Right.
So if you look at the way that FDA and pharma work,
Mm-hmm.
pharma will spend 20 million, 30 million, 40 million, 80 million on a product, but then they get to patent it.
Mm-hmm.
And the FDA approves the product, pharma has a patent, and they recoup their money by worldwide sales of a product that they have a patent on.
Right.
The problem is that peptides are not patentable. They're naturally occurring products, amino acids that are in the body.
Mm-hmm.
So if you can't patent it, pharma doesn't have an interest in it.
Correct.
And actually, this is now the biggest issue,
Yep.
is that pharma is scared of what's happening because these peptides are curing people.
Mm-hmm.
The easiest ones to go to are the FDA-approved ones, actually,
Sure.
which are the GLPs, right?
Yep.
GLP, glucagon-like peptide. That's your Ozempic, your Mounjaro, your retatrutide. All of these peptides are helping people lose weight, reduce inflammation, reduce risk of cancer, heal faster.
Yeah.
Their blood pressure is going down. Their diabetes is going away.
Right.
Right? So, well, what am I going to sell to them now as a
Right.
pharmaceutical company? These people are healthy,
Mm-hmm.
right? So there's definitely a disconnect and an issue here because pharma and the FDA don't know where peptides belong. But there was a Instagram that came out and it said, risks of taking peptides and the number of deaths per year.
Mm-hmm.
And it was like there's been 250,000 deaths from peptides last year. And they said, oh, no, actually, that's from NSAIDs.
There you go. That's
Right?
Great point.
You don't think about
No.
that. Like, we take Advil like it's candy.
Right over the counter.
Physicians are motivated to write prescriptions for NSAIDs.
Yeah.
What is it that you're giving to the patient?
Right.
You're giving them something that breaks their inflammatory cycle, but does zero to heal anything.
Right.
Right? You could do the same thing with a peptide, break the inflammatory cycle, and heal their tissue.
Isn't that amazing?
Right?
Yeah.
So it's just a mindset. It's just a process of education. It's a process of teaching people what works. And then once you catch on, you have the aha moment,
Yep.
then it's like, oh, okay, I get it. I'll tell you another anecdotal story that's really interesting.
Please.
So, you know who are the people who want to take peptides the most?
Who?
Physicians.
Really? Explain that to me.
Every physician that I talk to says, I would like a little more energy. And, I also put on a little bit of weight. And, I don't know if I want to take the GLPs, but is there a way to lose weight without the GLPs? And, when I play tennis, my back hurts and my knee hurts. And what do you have for that?
Mm-hmm.
And I'm like, it's easy. Take Clove,
Yeah.
take tesamorelin, and take NAD. You'll feel a million times better.
Absolutely.
They start on it, and then they're like, man, this stuff's amazing, but it's not FDA approved. And I'm like, you're putting it in your own body.
Right.
They're like, you know what? You're right. Yeah. Okay. Yeah. Sign me up.
Sure.
So, I think that unfortunately, physicians have been paralyzed a bit.
Sure.
And so part of the goal with Alpha Bioscience is to break the paralysis, right? Make them comfortable with the fact that the FDA is not the end-all, be-all answer for everything.
Right.
These are naturally occurring materials. There's no financial benefit for them in pharmaceutical companies, which means that they don't go to the FDA for approval. But these products are probably safer than NSAIDs,
Right.
right? And you prescribe NSAIDs like crazy. And I think once that mindset starts to change, then we're going to be off to the races.
So, Doc, tell me, what's your ultimate vision for Alpha Bioscience?
I mean, baby steps for us at the beginning, right? So the baby steps are we want to educate doctors. We want to build a team that goes out and makes doctors know that Alpha Bioscience, make sure that doctors know about Alpha Bioscience and what we're offering. We want to make sure that peptides are safe, and we want to get them out in a way where both the physician and the patients are comfortable with it.
Mm-hmm.
For me, in my professional life, it's always been about progress. right? So we already are starting to look at what are the easier ways of possibly allowing peptides to be used, right? So, currently the best use of peptides is by injection. I mean, the injections are really easy. The needle is this big.
Sub-Q.
And you barely feel it. And once patients get comfortable with doing it 1 or 2 or 3 times, I don't even think about it anymore when I do it. But are there other ways we can do it? So we're already starting to look at nasal sprays. Same peptide, same quality, but you just spray it in your nose. And so we're going to start to do testing, progress, different ways of delivery, so that we can offer patients what is comfortable for them, right?
Sure.
You can't give yourself an injection. Maybe we'll give you a nasal spray. Maybe we'll start using transdermal patches. So part of Alpha Bioscience, and the reason I wanted the name to be Bioscience is from a scientific standpoint, building a second team of scientists who are going to be working hand in hand with our team of doctors to build the better products that are going to be available for better service to the patient. And I think that is going to help bring peptides even more mainstream, because injecting yourself probably is not so fun for most people.
Sure.
And it's also what makes some people not even get into the peptide world.
Right.
So we're working to make that better.
Yeah, streamlining different methods of administration is going to be fantastic.
Yeah.
I think that's great.
We're on it.
Absolutely. Tell us where we can find Alpha Bioscience right now.
So Alpha Bioscience, ABS, so abs-health.com.
Great.
And I think that what we really are aiming for, again, that I think is important is, I don't care if you want to sell peptides or not. I don't care if you want to refer your patients for peptides or not. What I really care about first and foremost is to change the mindset of physicians by educating them. So our number one protocol at Alpha Bioscience or ABS is education, education, education. We'll give you as much as you want. You want simple stuff, we'll give you that. You want complicated stuff, we'll give you that. You want to know dosing schedules, we'll give you that. You want to know PubMed articles, we'll give you that. Whatever you need to get educated, and then you can make your own decisions. Maybe the answer is for you as a physician to get on peptides and see. That's what happened with me, right? That's what changed my world. I feel 25 years younger. I feel like I'm 30 years old. And I will tell you, I'm 55. And I really was like, this is it. Like, tennis is becoming hard for me. I can't play the kids anymore. When I played 20-year-olds in tennis, my recovery would take 2-3 days. And now I'm like, I'll play a match and go home and work out and then go play again the next day. And no problem.
Yeah.
And it's really because of the peptides, because there's nothing else out there that I can see that made the difference.
Sure. Well, I love how life-changing it's been for you and how much you want to actually help change people's lives for the better too.
Yeah, you got to. That's it.
Yep, absolutely.
One step at a time.
We'll get there. Pleasure, Dr. Bob. Thanks for doing this.
Thank you.
Really appreciate it.
I appreciate it.